Dr. Sharda Jain. I'm going to give you an overview of CERVAVAC, a silver bullet for protection against cervical cancer, our indigenous vaccine against HPV. Couple of slides I'm going to show on the basics of HPV you all should know. Few points I will emphasize. HPV spreads by sexual activity, can spread through vaginal, anal, and oral sex with someone who has the virus. It is most commonly spread during the vaginal or anal sex. It also spreads through close skin-to-skin touching during sex. An infected person with HPV can pass the infection to someone even when they have no signs and symptoms. If a person is sexually active, she can get HPV even if he or she have had sex with only one person. Symptoms can be developed years after having sex with someone who has the infection. This makes it hard to know when the person first got infected. As you can see in this particular slide, 6 to 7% of Indians today have HPV. Both sexes get it, and almost everybody gets infection when they're young. Most HPV infections clear on their own, but persistent infection can lead to certain cancers or other diseases. By age 30, as far as the women are concerned, almost 50% get it clearance, and in fact, few studies show that it is almost touches 30%. But as far as the men folk are concerned, their clearance is only to the tune of 40%, and 60% the infection remains, which is a big source of infection to the female partner. Another fact you should also know about HPV and cervical cancer: HPV evades the immune system. By this I mean the HPV virus does not cause cell death, which means that the immune system is not alerted. In the cell, the HPV virus hides while multiplying, and HPV infection occurs locally at the cervix, and therefore there's no presence of the virus in the bloodstream. So there's no test available by which you can test HPV by the blood test. Poor exposure to antigen presenting cells, there's no inflammation, no attraction of immune cells, local immunosuppression is there, and there is no viremia. You all know about HPV life cycle in the cervical epithelium and how from a normal epithelium it gets into cervical intraepithelial neoplasia grade 1, grade 2, and grade 3. We all know that cervical intraepithelial in neoplasia grade 1, the chance of invasive malignancy is 1%, while in grade 2 it is 5%, while in grade 3 it is close to 30 to 80%. You can see here the HPV types and the potential to cause cancer. At least 30 HPV types target genital mucosa, and they are classified both as high risk and low risk. High risk also cause oncogeny because they cause cancer, and low risk are the ones are benign and they do not cause cancer, they cause genital warts. So you can see another slide: benign lesions called genital warts, and malignant lesions which are oncogenic cause cancer. And you can see here that globally 16 and 18 together account for 75% of cervical cancer cases. In India, it accounts for 83.32% of cases of cervical cancer, and other oncogenic types which are also responsible for cancer cervix are 45, 6%, 31 is 4%, 33, 4%, 52, 3%, 58, 2%. These are the studies done by WHO in our country. Low-risk types cause benign genital warts and lesions, and 90% of genital warts are due to HPV 6 and 11. You can see here, as far as India is concerned, 83% of the cervical cancer in India are caused by 16, HPV 16 and 18, and 6 and 11 cause 90% of the anogenital warts. Now, coming to Indian cervical cancer, we all know that India is a capital of cervical cancer. 1/5 of the global cases occur in India, and 1/4 of the total deaths of the cervical cancer also occur in India. We also know this is the pyramid of cervical cancer prevention. Uh, the base is formed by the vaccination. Uh, ICMR, beautiful large study, well respected, shows that if you give any population the vaccination against HPV, 50% of the incidence of cervical cancer can be brought down. And the secondary prevention are screening, and third is cancer treatment, and fourth is palliative treatment. Now, coming to the HPV vaccine and the cancer prevention in the real world data. You all know that if you give a vaccination to any population, 50% decrease in the load of cervical cancer is brought about, and this is a famous ICMR study. Another wonderful study, which you can see here, risk of cervical cancer who are vaccinated before the age of 17 years was 88%. You can see the interrupted blue lines is rock bottom. They are prevented. The ones which are vaccinated between 17 to 30 years, you can see there is a decrease, market decrease. But this is the red line shows the cases which are remain unvaccinated. So if a person gets a vaccination by age 13, 87% decreases there in cervical cancer. But if they are vaccinated, if the group is vaccinated by age 16, 62% decrease will be there in total cases of cervical cancer. And if they are vaccinated later on, the incidence of drop will be much less than when they are vaccinated before the age of 13 years. So the clear message is, if younger, the better for vaccination. This does not mean you cannot give a vaccine to a woman who is more than 26 years. But the priority is younger people for quick control of cervical cancer. This particular is a famous study of Gavi, which shows that in case if you give 1,000 vaccination, 20 deaths because of the cervical cancer are averted. And no other vaccination comes near HPV vaccination in terms of saving lives is concerned. Next one is hepatitis B, where 1,000 vaccination means 10 lives are saved. So this particular slide must be remembered, that HPV vaccination is must. Now, this slide shows that, in 2006, the vaccine was approved, the Gardasil were approved by US FDA, and in 2008, it came in the Indian market, and by 2016, the WHO said that the Gardasil, instead of 3 doses, 2 doses are enough for adolescent group. And now, 2020, we find that the Gardasil has completed 16 years of its existence. Gardasil 9 was introduced in Indian market in 2021, while CERVAVAC is available freely now from 182023. Now, this is the first indigenous vaccine against HPV called CERVAVAC, and the R&D got started in 2010. It went through a phase 1, phase 2, and phase 3 trial, and finally DCGI clearance was there in 2022, and now it has hit the market for a free supply. We all know that WHO had given a clarion call in 2020 for November for 90-70-90, for which 90% of the adolescent girls must be vaccinated, 70% ladies must be screened by screening, which is a high performance test by age 35, and then it should be done again at 45 years, and 90% of the precancerous lesion diagnosed should be treated by gynecologists in the country. Now, our focus today of talk is the vaccination, that the girl should be fully vaccinated by the age 15 years. Now, here I just wish to tell you, all of you know everything about HPV vaccination, and a girl, child, and a woman is concerned, but the expert pleaded in Australia that HPV vaccination should be given to both boys as well as girls for a complete elimination of cervical cancer. And the same, both North India Gynecologist Forum and Delhi Gynecologist feel same, that now it is permitted up to 26 years. We have indigenous vaccine. Boys should not be denied of vaccination till the age 26 years. And this slide shows that, this is Gardasil. Gardasil 4 is only approved for women in this particular country. Till 9 to 14 years, 2 doses, conventional, what is with the DCGI. And as far as the woman more than 15 are concerned, 3 doses. Gardasil 9 for boys is only less than 15 years, 3 doses have to be given. And more than 15 years, also 3 doses have to be given. CERVAVAC, both for boys and girls, 9 to 14 years, 2 doses are recommended, and 15 to 26 years, 3 doses are recommended. So now I'm going to talk in detail about WHO SAGE study, which has come out in 22, which says that up to 9 to 14 years, 1 dose is good enough as 2 doses. In fact, they did a further studies and extended this particular cutoff to 20 years. And according to that, that 1 dose from 9 to 20 years is required, while in comparison to 2 doses. 2 doses के बदले 1 dose भी उतनी ही effective है. But if a person is more than 20 years, 2 doses are required at the gap of 6 months. And this is the kind of we must put it up in our waiting area, so at least everybody is informed about this kind of vaccination, that it is available with you. What about HIV positive cases? HIV positive cases, because they were high rate of persistent HPV infection as compared to HIV uninfected people. It is said that 9 to 15 years, 2 doses, and above 15 years, 3 doses should be given as far as HIV is concerned. And then also they should tell that we are not sure whether the antibodies will be produced to a sufficient amount and will give them a protection. So recommendation, the good practice statement to prevent cervical cancer is that 90% of the girls less than 15 years to be vaccinated. Single dose of Gardasil has been cleared by the WHO, and my second presentation will probably show you the whole thing which has gone on to come to that particular recommendations. So my request to each one of you is that create awareness, and active participation of 40,000 gynecologists of FOXY. If they do it, I'm sure the job will be done with the support of the government. Thank you very much.